Sir, over to you, sir. You may start the session.
Yeah, thank you. Good evening, one and all. I take this opportunity to welcome you all on behalf of Hetero Healthcare. My name is Rajamanikam, working as a Senior Sales Manager of Hetero Healthcare, CNS Division for South. First of all, I'm thanking you all for joining us today to discuss on the topic role of Cariprazine in bipolar depression. And today we have two eminent speakers. One is Dr. Siva Anoop Yella, is the speaker, and our moderator, Dr. Nithin Kondapuram. And just a brief about Hetero Healthcare. As you know about Hetero Healthcare, we are the largest R&D wings having 360-degree solution provider, more than 25 years of excellence in multiple therapies, currently present in more than 126 countries worldwide, more than 300 products across various therapeutic categories such as HIV, AIDS, oncology, cardiovascular, neurology, and psychiatry. A distinction of bringing 4 biosimilar products to the market and 36 plus state-of-art manufacturing facilities across the globe, pioneering in quality and innovation. I'll just introduce first the speaker, then I'll introduce the chairperson. First, I'll introduce the speaker. Dr. Siva Anoop Yella is a consultant psychiatrist at Medicover Hospitals, High Tech City, Hyderabad. He has done his MD psychiatry from Institute of Mental Health, Osmania Medical College, Hyderabad, and MBBS from Chalmeda Anandrao Institute of Medical Sciences, Karimnagar. Currently working as a chief consultant psychiatrist at Medicover Hospital, High Tech City, Hyderabad. He is an international certified addiction professional and internationally certified life coach. He is also an international drug demand reduction professional. He is a fellow of Indian Association of Private Psychiatry and also has a fellowship in sexual medicine. He is a member of International Society of Substance Use Professionals, member of Indian Psychiatric Society, member of Indian Medical Association, member of Addiction Psychiatry Society of India. He has received Best Research Paper Award for his presentation in International Conference on Neurosciences and Psychiatry held in Vienna, Austria, and also in World Congress of Psychiatry, Thailand. He participated and presented papers. He is the recipient of Dr. APJ Abdul Kalam Award for the year 2023 and Dr. B. Anand IMH Alumni Award, late Dr. Muluri Shivakumar Reddy Memorial Award, and add some more few. He received late Dr. Sita Ramaya and Krishna Lila Award. He has received award as a speaker in TNSIE Telangana Innovation in Inclusion Summit on ADHD in the year 2022. And we are going to hear from him. The topic is role of Cariprazine in bipolar depression. And today with us, the chairperson is Dr. Nithin Kondapuram. Is a psychiatrist and mental health researcher, AI and virtual reality co-founder. Basic information about doctor is he has done his master's in psychiatry epidemiology, postgraduate diploma in psychiatry, and he has done his MBBS at Mysore Medical College and Research Institute of Mysore. And doctor was a project coordinator in NIMANS during September till date. His responsibilities as a project coordinator in NIMANS is training of medical officers, system strengthening, and he is also associated with the government of Telangana on women's mental health. And he is doing a program planning for NIMANS and implementation of the programs of the government, monitoring and evaluating and creating validating assessment tools for the local population. And he is a consultant psychiatrist from 2019 till date in Aster Prime Hospitals, Amirpet, Hyderabad. The major work he is doing on psychiatry and social activities. He is working with other healthcare team members to develop individuals' treatment plan and ensuring continuity of care through collaboration. And he is participating in research studies. He is a research analyst with Harvard Public School from August 2018 to July 2019. He built a capacity of facilitating the adoption of practices to use or draw on evidence in public health communication and practice under Professor Vishwanath. And he was a research assistant previously at Harvard, June 2018 to July 2018. He has done various analyzing work, and he has built a public agenda on policy support for the public health funded by Bill Gates and Melinda Gates Foundation under the able guidance of Vishwanath professor. And for his upload, many other things are there. He is graduate in, he worked as a graduate research assistant, senior research fellow. He has got a vast experience of research, and to his upload, he is associated with NIMANS and doing lot of work to the junior residents in the Department of Psychiatry. And he is working with the psychiatric rehabilitation centers with NIMANS. And over to you, sir.
Yeah, hello everyone. I am Nithin Kondapuram. I welcome everyone for this interesting session on cariprazine and bipolar depression. Thank you, sir, for introducing me and Anu. It's a very interesting topic because cariprazine we have seen over the years how it has helped in bipolar depression, and Anup will be talking more about. We all know Anup. He is a very good a prolific speaker. He has done a lot of work on cariprazine and especially in bipolar depression. We all know how cariprazine can be used in schizophrenia and and other psychotic symptoms, but its use in bipolar depression has been very minimal. The knowledge about the bipolar depression is very minimal, but it has been used vastly in the European countries, especially in the Western world, but the evidence in India is very less. So Anup will be speaking little bit more about cariprazine, especially in bipolar depression, and then let's have more discussion about this, how cariprazine can be used in bipolar depression, and then let's have more discussion so that we can use this molecule and see how we can use in bipolar depression. And I hand it over to Anu to take the discussion forward. Over to you, Anu.
Thank you so much, sir. Thank you so much for the wonderful introduction. And here we are uh, to discuss about a very important molecule, cariprazine, which has a wide variety of uses actually. We have seen many good results with many of the mental illnesses, starting with schizophrenia and bipolar disorder, and especially in mania. But what evidence says? What is the mechanism of action? What are we going to learn about the different uses of cariprazine in bipolar depression? As we know that bipolar depression is difficult to detect. So we need to be very careful while treating bipolar depression due to a chance of switch to mania. So I'll be sharing my slides of today's presentation. So I'm Dr. Siva Anoop Yella. I'm a consultant psychiatrist at Medicover Hospital, High Tech City, Hyderabad, as well as Aster Hospital, Ameerpet, Hyderabad. And I did my MD in Institute of Mental Health, Hyderabad. I'll be discussing about an evidence-based overview of the role of cariprazine in treatment of bipolar depression. My overview of presentation would be, I'll be just slightly touching upon what bipolar disorder is, and then I will be discussing about how cariprazine is going to act at different receptor levels and the role of different receptor contributions. And I will also discuss about the efficacy of cariprazine in bipolar depression. And later on, moving to how it is being used in complex cases, special populations, and what are the different research and trials that are being undergoing currently, and what are the future perspectives of cariprazine. So we all know that bipolar disorder, it's a chronic condition with different episodes alternating between mania, hypomania, and depression. Where mania, there would be symptoms of elated mood, boastful talk, delusions of grandeur, and also a decreased need for sleep. Whereas hypomania, the intensity of the symptoms would be a lesser severity as that of mania. And depression. Depression would be characterized by symptoms of persistent low mood, decreased interest in their daily activities, loss of motivation, decreased sleep, and also suicidal thoughts, as well as loss of appetite, feeling hopeless most of the times. Where in depression, bipolar depression, we need to identify certain warning signs, especially like successful suicidal attempts and aggression, excessive anger, which are pointers towards bipolar depression. Not only that, even family history of bipolar disorder and even thyroid disorders, especially hypothyroidism, and less cases, in rare cases, even hyperthyroidism as well. So whenever these are there, then it points towards bipolar depression. Along with that, young age of onset is also a pointer towards bipolar depression. So we need to be very careful while treating any depressive episode, because depression could switch into mania if at all it is just treated as a unipolar depression. Then there are no pointers identified during this stage. So it will actually contribute to a very poor quality of life for the patient, and there will be functional impairment, social skills will be hampered, and high suicidal risk. This is a very important thing that we need to identify. Feelings of hopelessness is a warning sign of successful suicidal attempts. So identifying all these factors is very important when treating a case of any depression. So moving to cariprazine, we all know that it is an atypical antipsychotic. So how does it act? Mainly, it acts on the D3 receptors and D2 receptors as a partial agonist, where it has more preference towards the D3 receptors. And serotonin 5-HT1A partial agonism is seen along with serotonin 5-HT2A antagonism. FDA approval is given for schizophrenia at dosage ranges of 1.5 to 6 milligram per day. Whereas in acute manic or mixed bipolar episodes, bipolar 1, 3 to 6 mg per day is recommended. Whereas in bipolar depression, 1.5 is the initial dosage that we can start, and gradually escalating up to 3 mg per day. And also it is approved, FDA approved in 2022 for major depressive disorder as an adjunctive therapy. So the role of cariprazine in schizophrenia, bipolar disorder, and major depressive disorder is numerous. So this is how cariprazine is having different mechanism of actions. It has high propensity for D3 receptors, and then 5-HT2B, 5-HT1A, and D2, 5-HT2A, H1, 5-HT7, 5-HT2C, as well as alpha-1 agonism. So all these are different receptors on which cariprazine acts on. So moving on to the next topic, that is mood stabilization through D3 receptor activity. So how does cariprazine act on the D3 receptor? What is the role of D3 receptor when it comes to cariprazine? D3 receptors are highly expressed in the limbic regions, especially nucleus accumbens and amygdala, which regulate mood, motivation, and reward processing. The key areas which are disrupted in bipolar depression. Because it is involved in highly emotional processing and the reward processing, this is the main receptor that is involved. And partial agonism is cariprazine acts as a partial agonist at the D3 receptors, providing a balanced modulation of dopamine signaling. In cases like depression, where there is low dopamine levels, it stimulates the D3 receptors and it increases the mood and even reduces anhedonia, lack of interest, and lack of motivation. So, due to enhanced dopamine activity, the symptoms of depression reduce. And in hypodopaminergic states, that is in mania or mixed episodes, it actually reduces the excessive dopamine signaling by competing with the endogenous dopamine. And where there is overstimulation of dopamine in case of mania and mixed episodes, this molecule prevents this overstimulation and thereby reduces the dopamine levels. So what is the clinical impact? What happens after this D3 action? This dual action stabilizes mood across both depressive as well as manic states. And we can safely give it in order to prevent any kind of mood switching. So if at all there is any suspect that a patient is probably a suspect of bipolar depression, you can safely give cariprazine at low doses. Start with low doses 1.5 mg per day. And if at all, if possible, as an adjunctive to any kind of SSRI or SNRI. So this is the advantage of cariprazine in case of preventing switch to mania. So studies, especially RGH-MD 56, show cariprazine's efficacy in reducing the MADRS scores, particularly for symptoms like sadness and lassitude, which are linked to limbic dysfunction. So this is a very famous study to prove the efficacy of cariprazine, where they have found out that the Montgomery-Åsberg depression rating scale scores have reduced. And what is the advantage of having a D3 preference? Unlike other antipsychotics like lurazidone or quetiapine, where lurazidone usually doesn't have much focus on the receptor action. With a stronger D2 focus and cariprazine's higher D3 affinity, almost up to 10 times higher than that of D2. So it targets reward and emotional regulation more directly, contributing to its full spectrum efficacy in the bipolar 1 disorder. So that's how we have advantage of cariprazine when compared to quetiapine and lurazidone. So definitely, it's a preferable molecule when it comes to bipolar depression. Looking at the good advantages of D3 receptor action. And also, we have to discuss, we cannot neglect the cognitive benefits which are occurring due to the D3 receptor activity. So D3 receptors, how are they involved in cognition? You might be wondering, why is D3 receptors involved in cognition? Because D3 receptors are mainly and also found in prefrontal cortex, which is a region which is crucial for executive functions, critical thinking, attention, and working memory. When we see a patient who is diagnosed with bipolar depression, mainly the prefrontal cortex is involved. Their executive functions, attention, and working memory can be impaired. That's why any case of depression, usually they have symptoms of memory disturbances as well. So prefrontal cortex is the main region involved, and it is impaired in bipolar depression. So what is the mechanism? How does it get involved? Dopamine modulation is the main mechanism where partial agonism at the D3 receptors, like I already mentioned, it enhances the dopamine release in the prefrontal cortex. and it improves the executive functions as well as cognitive flexibility, creative thinking, without causing any kind of overstimulation or switching to mania. And studies also suggest that it has neuroprotective action, mainly due to this activation at the D3 receptors. It promotes neurogenesis, synthesis of new neurons, and synaptic plasticity, which is very important. And especially synaptic plasticity is promoted in the hippocampus and cortex, where the long-term memory is involved. So long-term memory is not affected because of this neuroprotective action. And also, any kind of cognitive impairment can be counteracted because of this neuroprotective action of this molecule. And the third one is reward processing. When D3 receptors are involved, the agonistic action, there will be reward signaling. And cariprazine mainly motivates, improves motivation and goal-directed behavior. And because when we see in case of schizophrenia as well as in bipolar disorder per se, there won't be any or reduced goal-directed behaviors and lack of motivation. And definitely we can see cognitive impairment. The advantages of this D3 receptor agonism is involvement of these cognitive domains also. It improves motivation and goal-directed behavior. So what does clinical evidence say? What are the different trials? Post-hoc analysis of cariprazine trials indicate that improvements in cognitive symptoms like cognitive difficulties on MADRS scores have actually improved. And additionally, its efficacy in patients with subsyndromal manic features and even hypomania. This has actually preserved cognitive clarity compared to other antipsychotics like quetiapine, lurasidone, or olanzapine. So when it comes to other agents, cariprazine's D3 preference is a unique role. It distinguishes it from other atypical antipsychotics, and also which all the other atypical antipsychotics, they primarily target the D2 receptors and may cause cognitive blunting and emotional blunting. Sometimes even cognitive impairment, they lack attention, concentration, and even memory, working memory is impaired because of this D2 receptor action. So many of the atypical antipsychotics, which primarily target D2 receptors, they cause excessive dopamine blockade and also sedation. The advantage over other atypical antipsychotics when it comes to cariprazine is lesser sedation. So that is also one unique role that cariprazine can play. So what are the additional contributions from these receptor profiles? The other one, the other receptors which I already mentioned, that is 5-HT1A partial agonism. It enhances the serotonin signaling in the prefrontal cortex. So as we understand the prefrontal cortex role in the disease or disorder enhancement in case of schizophrenia and bipolar disorder, the prefrontal cortex plays a major role. And this partial agonism at this receptor, it actually enhances or stabilizes the mood. It has a mood stabilizer role as well, and cognitive function by reducing anxiety and improving emotional regulation. Many of my patients have actually improved in terms of their anxiety as well when it comes to hospital anxiety depression rating scale. The anxiety symptoms also have been covered. The symptoms have reduced in terms of their anxiousness, fearfulness, and other aspects of anxiety also have been covered with this molecule, cariprazine. And 5-HT2A antagonism, it reduces the cortical excitability. we can see in hyperexcitability states, the cortex, especially prefrontal cortex, has a lot of excitation and causes this hyper-elated mood, aggression, and also delusions of grandiosity. So this 5-HT2A antagonism has advantage of stabilizing the mood and mitigates cognitive overload in case of mixed states. What are the other effects? Synergistic effects are also seen because it has all these multiple roles on different mechanism, different receptors. The combination of this D3, D2, and 5-HT1A, 5-HT2A, all these receptor actions actually creates a good balanced neurochemical environment. So it improves or optimizes the mood as well as cognition. So coming to some studies, we'll discuss about some studies, major studies. There were 3 pivotal randomized control trials, that is RGHMD 56 and 53 and 54. These were the pivotal randomized control studies which have been done, where they have done a double-blind placebo-controlled study for 6 to 8 weeks. They have primarily observed, the primary outcome was changes in the MADRS scores at 6th week. So they have actually started with 1.5 mg of cariprazine per day, and they have seen a significant MADRS score reduction when compared to placebo. And cariprazine at 3 mg per day, they have found that greater reduction, but not always significant after multiplicity adjustment was done. But 1.5 mg had good response in case of MADRS scores. The higher response and remission rates for bipolar 1 depression have been observed. The relative risk was found to be 1.27 and 1.41 respectively. The remission response rates were 1.27 and remission rates were 1.41. So there was another study done by Early WR et al., where they have seen the efficacy and safety of cariprazine in bipolar 1 depression. It's a double-blind placebo-controlled phase 3 study, which was published in 2020, where from this chart we can see that MADRS scores have reduced significantly and compared to the placebo. If you can see, this dotted lines is a placebo. 1.5 mg of cariprazine has significantly reduced the MADRS scores at the end of 6th week. And clinical global improvement scale score also showed significant improvements in their symptoms profile. So 1.5 and 3 mg had almost significant results, but at the end of 6th week, a little improvement was seen compared to the 3 mg. So I think we can stick to 1.5 mg and see until the 6th week, rather than escalating the dose furthermore until 6th week. So after 6th week, if there's no improvement, definitely we can go up to higher dose of 3 mg of cariprazine. So what is a broad spectrum efficacy? So cariprazine has been shown to be effective for depressive symptoms in bipolar 1 depression, including subsyndromal manic symptoms. When there is depressive symptoms, sometimes some manic symptoms get masked. Slight anger or slight grandiosity can be masked also. So in that cases also, cariprazine has been shown to be effective. And it reduces manic symptoms in acute mania as well as the mixed episodes without any worsening of depressive symptoms. In post-hoc analysis, it was found that, like I already mentioned, there was significant improvement in individual MADRS scores items also, that is sadness and lassitude. And this potential cognitive benefits are also seen. So what is the safety and tolerability of cariprazine? The common adverse effects found out were equivalent to aripiprazole, like akathisia and insomnia. More than 10% cases actually had these symptoms. And low incidence of weight gain seen, that is one, slightest advantage over other atypical antipsychotics, which have higher weight gain. When it comes to quetiapine or olanzapine or clozapine, and metabolic changes. So in cases of any metabolic syndrome or hyperlipidemia or diabetes, we can definitely prefer cariprazine. So in some studies, it was found that there were discontinuation rates. Definitely, there would be discontinuation for many of the patients, but in this, it was significantly at a lower rates. It was up to 7.8. Still, it's higher, but comparatively lesser than other atypical antipsychotics or typical antipsychotics. And it was found that 1.5 mg per day had good improvements as well as tolerability levels and lower adverse rates. So that's why slow titration is advisable, slowly increasing to 3 mg after adequate response has not been occurred, even after 6th week, then we can definitely escalate it to above 1.5 mg. So we need to see the response at least till 6 weeks. So what is the role of cariprazine in complex cases? I've seen in treatment-resistant bipolar depression when other SSRIs and other mood stabilizers have not worked. It has definitely, reduced the HAM-D scores when it was given as an augmentation therapy. So treatment-resistant bipolar depression, definitely yes, for cariprazine. And comorbid substance use disorder. Due to its D3 activity, reduced craving was seen. Preliminary evidence actually suggests that it also has this reduced craving ability due to this D3 activity. And limitations excludes bipolar 2, rapid cycling, and psychotic features. Trials are still going on in these conditions. So rapid cycling bipolar disorder, definitely many ongoing trials are going on. So we need to see. So why does cariprazine matter? Why should we prefer? What is the importance? Like you already mentioned in all the slides, how does it act through different mechanism of actions, through different receptors, D3, D2, 5-HT1A, 5-HT2, all these actually indicate that it has actually met all the unmet needs of different, antipsychotics or mood stabilizers or antidepressants. So its broader efficacy across all the mood states, it actually reduces the switch to mania, D3 receptor activity, and all this. Only drawback is that we need to watch for akathisia. And like I already mentioned, what are the ongoing trials in pediatric bipolar 1 depression and relapse prevention and long-term safety are the ongoing trials that are being going on. What are the research gaps? Head-to-head comparisons with other agents. Those are the research gaps that have been identified. And like I mentioned, rapid cycling bipolar disorder and bipolar 2, long-term outcomes, and in case of prophylaxis, are we going to give it in prophylactic therapy and the adjunctive therapy for unipolar depression? The FDA has approved for this condition, but as a monotherapy, definitely we need to be watchful about it. So I would like to summarize that cariprazine is a very effective, well tolerated, except for akathisia, a low weight gain, and D3 preferring mechanism and broad spectrum efficacy, high response and remission rates, good cognitive and substance use disorder benefits due to its reduced craving activity. So in different populations, pediatric cases as well as in geriatric bipolar disorders or schizophrenia, there are definitely research is going on and it requires even more clarity. So definitely in adults, it's always a win-win situation. And keeping in mind the good safety profile, we can definitely go for this cariprazine. Slow starting and with 1.5 mg per day. See the response. If the patient is aggressive, definitely you can go up to a higher doses vigorously also within the second week, but definitely wait for at least 6 weeks if at all needed and if at all the patient is not very aggressive. Like all the other antipsychotics and antidepressants and mood stabilizers, definitely wait and watch instead of going for aggressive dose titration. And thank you. If at all have any questions, we are open for discussion.
Thank you, Shivanup. That was a very comprehensive presentation covering all the receptors, and it was a kind of a small, like, you just took us through the whole anatomy of the brain and gave us about all the receptors and how it works on the receptors, and not only thinking about the skis but also thinking about the depression and how the different it works on the different receptors and all those things. Thank you very much for taking us basically not only on the anatomy but also about the psychopharmacology and all those things. Yes, over to you, Anup, and let's ask few of the questions if any of the members have few questions.
Yes, sir.
Sir, from webinar participants, there is no question as of now asked for, sir.
Sir,
And
actually, there are some questions.
yeah,
Yeah. So what I'll do is I'll paste here in the chat box.
yeah, please do that. Or you can tell the question or ask the question to sir. He will be taking it.
Okay. Sure. So, sir, one question has been asked. Sir, so far, any sexual side effects seen with cariprazine?
Usually with atypical antipsychotics, there will be elevation of the prolactin levels, which is definitely an advantage of cariprazine. It produces or decreases the prolactin levels, just like aripiprazole. So definitely there are no or minimal sexual side effects with cariprazine. That's another advantage. Even I have seen in many of my patients who actually had no sexual side effects or minimal. They haven't actually complained much of loss of libido or high prolactin levels. So that's a added advantage.
Okay. Okay. Fine. Fair enough, sir. One more. Sir, patients with cardiac history, which antipsychotic along with cariprazine is suitable? Monotherapy should I go with?
Yes, cariprazine doesn't or has very minimal effects on QTC prolongation. So cariprazine or lurasidone, they definitely have been shown good responses in case of cardiac patients with due to less or negligible cardiac side effects.
Okay.
Monotherapy, definitely we can go. I have prescribed in many of patients who are actually, in delirium also, who actually have undergone CABG or PTCA, post-PTCA. Cariprazine definitely has shown good response in controlling aggressive episodes in case of delirium. So it is cardiac safe along with lurasidone. Quetiapine definitely causes QT prolongation, so we need to be very watchful of quetiapine. So lurasidone and cariprazine show good response. due to their minimal or no effect on cardiac activity.
Okay. So one more question. That is, can cariprazine induce hyperglycemia? And if yes, then how do I manage?
So it is actually negligible. It is safely prescribed in case of diabetic patients, just like aripiprazole. And cariprazine also has that added advantage. That's why in metabolic syndrome cases, in hyperlipidemia or diabetic patients, we can definitely go for cariprazine. Rare cases, it usually, I mean, according to the studies, it was hardly negligible cases that have seen hyperglycemia, increased glucose levels due to cariprazine. So it is a good molecule even in case of diabetic patients.
Okay. Okay. Sir, we had only these three questions from the participants.
Yes.
Sir,
Sir, from
one
the
question
panel,
actually.
yeah, from the panel, any question, sir? Dr. Manjunath, sir, or there is one more doctor has joined. Both of them can ask.
Okay.
Or Nithin, sir, with your closing remarks and summary, we can go ahead.
As Shivanub has told, cariprazine has been a promising molecule. Till now, majority of the psychiatrists, especially the young psychiatrists, have been used only in schizophrenia cases or in psychosis cases. But it has been a promising molecule, especially in bipolar depression, where a lot of them are scared about switch. Majority of them, whenever they say it's a bipolar depression, they are very scared about it. Being working, I have worked in the CanMed guidelines where using escitalopram or buprenorphine or any other antidepressants, even without we have to use a mood stabilizer there. But when it comes to cariprazine, you need not use a mood stabilizer. You can directly start cariprazine without any fear of any kind of switch to mania, and you can go up to 6 mg without any kind of side effects. There won't be any kind of sexual side effects. There won't be any kind of cognitive decline. There won't be any kind of side effects. Few of the patients might tell that they might have EPS, but that is something which is manageable. So if you ask me, cariprazine definitely has a very good role in managing bipolar depression. So I would suggest all the psychiatrists out there to go and try in few of the patients who have bipolar depression, try cariprazine in them, see the results, and once you are convinced that yes, this molecule is helpful in bipolar depression, then then you will get the confidence, and then you can use the molecule in them, and the evidence is already there. If you don't feel that okay, the research evidence is something which you don't believe in, try it out in your own patients, you will get the confidence. And I'm pretty sure that once you feel that confidence, you will use more than escitalopram or any other molecule for bipolar depression. And cariprazine is a promising molecule which has a better future, and definitely you can use it. And don't worry about the cost, it is very cheap out there in the market. Yes sir, back to you.
Thank you very much, sir. And all the participants, almost more than 60 participants has joined in the live webinar. They have spared their time in the Saturday evening with a lot of things outside. Still on the quest of thirst of knowledge, they have all joined. And you both has given a very good feast to us on the side, especially a very specific topic on bipolar depression, how this cariprazine plays a vital role, and there are studies and its cognitive advantage, and how to manage the side effects all. Thank you very much, sir, for your time and effort on behalf of Hetero Healthcare and the audience. Yes,
Thank you so much, the audience and everyone. Thank you, Nithin sir. Thank you, Hetero Pharma, for this opportunity.
Thank you, Anup, for spending so much of time, and thank you, Hetero Healthcare, for giving us the opportunity to be on this platform. And thank you, everyone, for joining on a Saturday night. And good night, everyone. And I give back to the Hetero Healthcare. Thank you.
Thank you.
thank you,
Thank you, sir.
thank you so much.
Thank you so much.
Thank you so much. Thank you.
Bye, sir.
Bye. Good night.
Sashidhar, you can stop the live. Yeah, yes.
Sure.
Live is stopped. Yes.
Okay.